Hey, good afternoon. This is Dr. Adam Teichman with PA Foot and Ankle Associates. We're starting a new series today called Get to Know Your Doctor at PA Foot and Ankle Associates. So we kind of convinced Dr. Simon Tabchi to be our guinea pig today. And we're going to be talking to Dr. Simon Tabchi, who's been with PA Foot and Ankle Associates for 3 years. He's originally from Allentown, and he did his podiatric medical school training in Temple University in Philadelphia and his residency at Crozier Medical Center, a 3-year surgical residency. So welcome, Dr. Tabchi. How are you doing today?
Good, thank you.
All right, great. So listen, this is our first time that we're doing the Get to Know Your Doctor series. I'm really glad to have you on board. And you're currently, I see, working today at Chew Street, correct? One of our offices in Allentown.
Yeah, correct.
All right, great. So everybody also to know that we are currently open treating acute patients as well as high-risk patient care, and also accepting new patients for any type of acute needs that they might have for their foot and ankle needs. So Simon, to start off, I did mention that you did some training as well. So where did you do your undergraduate school training?
So I went to Raven College here in Bethlehem, Pennsylvania, and directly after that, I went to podiatric medical school down in Temple, as you stated. So
great. So what made you get involved in podiatry? What actually caught your eye?
Podiatry is unique. I really like growing up, I liked kind of the family medicine aspect where you can get to know your patient, build that relationship. You have the same patients kind of coming to see you routinely. But I also like surgical. So podiatry pretty much gave me a mix of both where, I have my routine patients that we see for at-risk foot care every about 9-10 weeks, that you get to know them, you get to know their families, get to know stuff about them. But you also, we have the surgical component where anything from limb salvage to trauma, foot and ankle, you name it, we do it. And that really caught my eye right off the bat, doing both and, doing something that I would be able to help as many patients as possible. So.
No, that's great. I agree with you. Podiatry is a very rewarding career, and I think it's one of the few specialties that you can build a nice personal relationship with the patients as well.
Yeah.
Interacting with them about every 9 weeks for their at-risk foot care, whether diabetic or high-risk patients. I think that's a great, way to build that relationship and continue that relationship with patients as well. What do you find as the most rewarding thing you've done so far, in podiatric medicine and surgery? What do you find that sticks out for you?
I think the most rewarding, especially in our field, is, from getting a patient from point A to point B, meaning, they come in, they're having pain. They're having pain, whether it's preventing them from ambulating or doing their normal activities, and kind of seeing them progress from having all that pain when you first see them to pretty much being pain-free by the time they leave your office. One of the most rewarding is we have, especially in our practice, we have a lot of different modalities we're able to use in order to, even on the first appointment, decrease a lot of that discomfort for the patient, no matter what it is, whether it's bracing or injection therapy, oral therapy. We have now physical therapy incorporated with our practice as well, which has benefited a lot of our patients. We send our patients to our physical therapists who are able to, read our notes and really work hand in hand with us in order to get our patients, again, like I said, from point A to point B to get back to that pain-free lifestyle.
Great. So that's a great response, and I appreciate that. My next question is, why did you join PA Foot and Ankle Associates besides working with me and Tom Racchio? It's probably one of the best benefits. But what made you choose PA Foot and Ankle Associates over, other practices or other specialties that offer podiatric services?
I liked, like I said, I liked a lot of the different modalities I was able to present for my patients, as well as being able to actually come back to the area I grew up in and, take care of the patients in the area who I've pretty much grown up with my entire life. PA Foot and Ankle, we're a pretty large practice in the Valley. We have 5 docs. All of us work very well hand in hand together, feeding information off of each other and things like that. And, in our practice, we're able to go to the different hospital systems in the area in order to treat all different patients. So, having that type of, reputation in the area really drew me to the practice, and is why I decided to pursue that, and have now been here for 3 years. So.
Well, we're glad to have you on board. PA
Thank you.
Foot is definitely a collaboration of doctors. Like you said, we work together, we work well together. We do bounce ideas off each other, patients off each other as well. And there's not one thing that we cannot treat in this practice because of all the skills that the doctors have. Yourself included, myself, Dr. Rocchio, Dr. Bush, and Dr. Newton. We're well versed in all aspects of podiatric foot and ankle surgery, but also specialize on certain things as well. And you being also a wound care specialist and working out of the wound care center at St. Luke's kind of specializes yourself in doing limb salvage and wound care. What can you tell us about your experiences doing that?
That's actually probably one of the most rewarding parts about our field is saving people's limbs. The less limbs that are lost by an individual, the better for their health and their cardiovascular status and things like that. So, being able to be in the wound care center really allows us to be more hands-on, provide a lot of different resources for our patients that we're not able to get in the office. And that we're only able to get in the wound care center, even things like hyperbarics, and again, with, as I mentioned before, all the docs working together, I'm in the wound care center here at the Allentown campus at St. Luke's on Hamilton. So anytime any of the other docs have a patient who really needs to go to the wound care center, at least I'm there in order to provide that care and continue that continuity for that patient of a doctor that a familiar face for them, instead of, punting them off to a different area where they're not used to the physician or they feel comfortable with a particular physician. A lot of our patients actually like that idea where, if need be, they're able to be seen by me at the wound care center. Even if it's, either yours or Dr. Rocchio, Bush or Newton, we're always kind of, like you said, feeding information off of each other and patients off of each other. And anytime that patient needs to go to a wound care center, we're there to provide that type of care for them.
So also, when you do limb salvage and wound care, it's not just, doing office work or outpatient work. You do a lot of the inpatient work as well, at the Sacred Heart St. Luke's campus as well. You're, on the front lines dealing with these patients in the hospital, especially during, this pandemic that's going on.
Yep.
You are definitely on the front lines, putting yourself at risk, dealing with these, acute issues that with inpatient work as well. Tell us a little bit about your experiences working with the inpatients, and especially, maybe some of your thoughts about what's going on, and, what we can do or what our patients can do to be proactive in following the guidelines as well of the CDC, and also keeping themselves safe.
Yeah, right now, with the inpatient work, the nurses and docs in the hospital are being very cautious, very proactive. They're taking the proper steps and proper precaution in treating these patients, and making sure we get these patients from where they are when they first come in to, being healthier, and more cured. So, I see the nurses pretty much every day who are, taking care of these patients with COVID-19, and see how well versed they are in doing so. So, that provides a lot of comfort for a lot of patients, even for myself, going in and also seeing these patients as well, knowing that we have the proper materials in order to go in and see these patients. As far as our patients who are coming to the office, my biggest recommendation, what I keep telling a lot of my patients is, especially for, as you mentioned before, any type of acute trauma or acute wounds or anything like that, there's a lot of people who are afraid to come out right now. And my biggest, message to them is, we're taking every precaution in our practice to maintain the safety and well-being of all of our patients. I think the best thing that I've gotten feedback about that we started doing with our practice is, calling from their car in order to check in. A lot of our patients have really taken advantage of that, and once they get here, they call, they check in, they let us know they're here, and once the room is ready for them, they come up, and we take them right into the room in order to prevent as much contact between patients and different members of society as possible as they make their way up to the office. So I think that's been one thing that's been very beneficial. As far as for the general public, I mean, as of right now, we're making steps. We need to continue to listen to our government officials, our healthcare officials, and really take those precautionary steps of, maintaining social distancing, wearing your face mask when you're out in public in order to try to, limit this as much as possible and try to get back to as normal as a life as we can. And again, I state for all patients, whether it's in our field or any other field, if you're having any symptoms other than obviously the COVID-19, but anything going on, try not to put that off, because you could end up in a worse situation instead of, coming in and actually being seen by your provider. So like you mentioned, anything that you have going on, your foot and ankle, call, make an appointment. We have telehealth now available as well for all of our patients, which I've been doing a lot of that as well. In our field, a lot of stuff is hands-on. So there's only so much we can do with the telehealth, but we're able to still, examine the area, see if it looks infected, if an antibiotic needs to be sent or anything like that. And if it's something where the patient would benefit more from coming into the office, we will go down that path and set that up. But, if you feel safer just doing a telehealth visit at first, we're always readily available, no matter who the physician is. We're here to help you. We're here to take care of you and to make sure everybody stays healthy. So.
No, that's true. At PA Foot and Ankle, we really take pride in, following the CDC guidelines, and, it is an ever changing event with these new guidelines that come out all the time, especially cleanliness in the office and checklists that we created to make sure that every room is sterilely clean in between patients. All staff is well protected, wearing face masks and gloves. And with the new guidelines set up by Governor Wolf, everyone is mandated wherever they go to wear a mask as well. So, it's really important to follow these guidelines, and we follow those as well. Before we wrap up, Simon, tell me one thing, if you want the patients to know about you on a personal side. We always talk about the medical side of things, and talking about, what you can do as a doctor, as well as trained and well-versed in podiatry you are. But what are things that we can know about Simon on the personal side? Like, what do you like to do? If you want to talk a little about your life outside of work, go ahead and just give us a quick little input.
My life outside of work is I go home straight to my kids. I have 3 kids, a 2.5-year-old daughter, and a twin boy and girl who actually just turned 10 months a couple of days ago. So, my hobbies all revolve around them. I go home, obviously once I'm showered and clean and disinfected from the daily activities, I'm with them all day. I've always grown up playing music. Being a person of Syrian descent, my father taught me the Arabic guitar growing up, so I do play that. I used to play the Arabic drum growing up as well. Also took violin lessons, which I had stopped a long time ago, but hopefully we'll pick up at some point in the future. But my kids really enjoy the Arabic music as well. So anytime they're antsy or crying or anything like that, I always pull out the guitar and play it for them, and they enjoy it. So that's pretty much my day-to-day work and home with the kids. So it's the biggest blessing in my life, and it's the best thing in my life. And, everything we do is obviously for them, as I know you do as well. So
maybe you should play that guitar at some of our meetings for us.
I'll be more than happy to.
and I know you had more hair before you had kids, so don't worry about it. So
I had a lot more hair.
So listen, I really want to thank you, for taking the time and being our guinea pig today. I think this is great, and Simon, you are one of our respected doctors. I think we all respect you in the practice as well. You're a great foot and ankle surgeon, as well as a great physician and a great friend. So, I do appreciate you taking the time today to have us interview a little bit, and hopefully people take away some things that they didn't know about you or our practice during this time. So once again, I know you get back to work, but listen, be safe, be healthy, and we'll talk to you soon. Thank you again for taking the time. If you have anything else?
Thank you.
For the healthcare workers, go ahead and say it.
Yep. I just want to, thank everybody, from our healthcare workers to even our grocery store, all of our delivery service, our truck drivers, everyone who's still out there and performing their jobs. We thank you. We thank you for continuing to keep our country going. As healthcare officials, we kind of know what we're getting into. We know we're going to be dealing with disease, sickness, stuff like that. All of our other quote unquote essential employees who are still out on the front lines, like our truck drivers, our grocery store personnel, etc. They don't really sign up for this. So, let's try to thank them every once in a while when we see them, and try not to come down too hard on them with anything. But, really take the time to thank them. Anytime I'm at the grocery store, I do try to say thank you to all of them, because they really don't need to be there. Like I said, we sign up for this as healthcare officials, so we know where we're getting ourselves into. So, again, thank you to everybody who's on the front lines and taking the time to, make sure that we still are able to get our daily necessities and, still move forward in this country. And like I said before, hopefully we can get back to somewhat of a norm in the near future. So,
as the High School Musical said, we're all in this together, right?
So, yep, exactly.
And we
all we can do.
Take our time and take a step back, and sometimes just take a deep breath and then understand everybody's under the same amount of stress and that they're going through. So again, this is Get to Know Your Doctor. Today's Simon Tabchi from PA Foot and Ankle Associates. Again, we are here to help you. We offer telemedicine. We offer virtual appointments where you can wait in your car and we'll call you when you're let you know when your treatment room is ready. And we also accept all new patients as well for all acute foot and ankle problems or high risk patients. That includes wounds. Ingrown toenails can definitely be an issue, and if ignored can be a problem as well. The simplest things. So once again, thank you again, and
thank you.
We look forward to seeing you in the future, Simon. It was great.
Hopefully sometime soon, man.
All right. Bye.
See you. Bye-bye.